Okay, so good afternoon and welcome everyone. Today we have with us Dr. John Klir from Barbados, University of Barbados School of Medicine, and he's going to talk about medicine on Mars after 2050. So we'll have 25 minutes for the talk, and after we can have 5 minutes Q&A. So feel free to start writing your messages in the chat, and then we will answer them after the talk. So the floor is yours, Dr. Klir.
Okay, hello. I am really excited to be part of this virtual convention. I will be talking about medicine on Mars after 2050. So after first human colonies established on Mars, there will be many challenges. In terms of life and medicine, probably major challenges will include long-term ability to maintain and propagate human life and successfully adapt of people to conditions on Mars, specifically to major physiological challenges, which include low gravity, low pressure, high level of radiation, large temperature fluctuation, and high level of dust. As far as long-term effects on human body, well, we don't know yet. We are talking in terms of years, exposure over years and possibly over generations. Independent functioning of the colony will be eventually necessary in the future for permanent stability. There will be a process, of course. In initial stages, there will be dependence on Earth, including frequent, continuous communication and travel. Then, next stage, semi-independence, and eventually, after quite a few years, complete independence from Earth. And this will be regardless of course, well-developed communications and travel systems. There will be always communication between Earth and Mars. But probably main reasons for independence eventually, first of all, of course, in addition to reasons such as time and travel delays and travel disruption, actually maybe one of major reasons will be potential human extinction on Earth. Well, when you think space exploration, we can think is basically extension of human exploration on Earth. When we look of the millions and millions of years of history of humankind on Earth, so it's characterized by exploration, migrations, and tendencies to establish permanent habitats in different parts of from tropical environments to very severe Arctic conditions. So in these terms, space exploration is a major driving force for human exploration, including space exploration, is most probably survival. And therefore, the independently functioning colony on Mars eventually will be very important. Multi-system integrative approach will be required. Integration between all functional systems of the colony, including life support systems, providing water, oxygen, food, habitat control, energy, and all other resources. Of course, medicine directly involved with life, and community, and other systems. So all of these will equally contribute to stability and continuity of the colony. two systems and integration of life support system and medicine will be critical to sustain life on Mars. Now, medical advances on Earth will be used to develop effective and self-sufficient and self-operating medical system on Mars. Of course, medicine on Earth is continuously advancing. All of us witness every year major advances of medicine. So when we look just 50 plus years ago, so we can attest medicine was different. There were no computers in medicine. Very limited diagnostic methods, including ECG, X-ray, ultrasound, and a few others. There were very few medications, actually. Very limited therapeutics and medical procedures. When we look at present time, we have quite advanced technologies which are used in medicine, including diagnostic, therapeutics, robotics, molecular techniques, medical genetics. So we can only predict future developments of medicine. So therefore, we can say the medical system on Mars will be developed based on medical advances and system on Earth. So they will be both advanced in parallel, and medicine on Mars will be only specifically developed and optimized for those special conditions on Mars, as we discussed before. Self-operating life and medical system, including highly advanced and individualized medical monitoring system, such as wearable, implantable, built into microenvironments of people, will be or required. Highly advanced and individualized medical monitoring devices will provide continuous monitoring of multiple variables, including physiological, biochemical, behavioral, and location. Highly sophisticated algorithms and machine learning processes will be used to achieve it. And these systems will be able to produce specific responses for individual patients. So they will be very specialized for patients in terms such as alerting patients whenever needed, reminding to take medications, advising patients healthy lifestyles and positive thinking. Medicine will include certain components. So basically, it will be fusion of these components, highly advanced system technology, and highly advanced medicine. So these major components fusing, contributing to medicine future will, of course, first of all include biomedical sciences, biomedical engineering, but of course also highly advanced system technology. So the fusion of these components will produce medical systems. Critical role of highly advanced technologies, as we just mentioned, which will be a critical part of medicine, will include artificial intelligence systems, self-learning systems, cognitive technologies, deep learning systems, and possibly other technologies developed in the future. In terms of medicine, major focus in medicine definitely will be preventive medicine. It will change. The main focus will change. Disease prevention from treatment of diseases. Actually, even at present time already, we have a very significant amount of evidence supporting benefits of preventive medicine, preventing diseases rather than waiting and treating them. So all context of all the medical advances and technologies, definitely medicine will focus on disease prevention. So what will be the role of artificial intelligence system? The role will be to analyze patterns and trends and producing highly personalized information. Key is the personalized information, which will be combined with biomedical population data to advise decision-making whenever required. Automated decision support system will be required to produce optimal medical care. So what do we understand by optimal medical care? First of all, disease prevention, as we said, there's a major focus. Diagnostics, treatment and management, and of course, all invasive and surgical procedures. Application of artificial intelligence based robotics and medical avatars will be critical to deliver optimal medical care. These robotics avatars will include, for instance, nano robotics and other robotic systems developed in the future. Now, what will be the role of medical professionals? The role will change from a traditional approach, which is direct physical interaction of doctors with their patient, to actually more monitoring role. So doctors will function more like monitors, overseeing general effectiveness and direction of patient care. So therefore, future medical professional doctors will be highly knowledgeable biomedical scientists who will be developing and utilizing new biomedical methods, nanotechnology, advanced genetic technologies, machine learning algorithms, artificial neural networks, and other future techniques. So again, it's consistent with that prediction. The doctors will be more or less, instead of direct interaction with patients, they will function as biomedical scientists, monitoring, overseeing care of patients. To successfully sustain human life on Mars in the future, advanced medical genetic technologies will be required to make future generation to adapt to those special environmental challenges on Mars, as we discussed before, including low gravity, low pressure, extreme temperatures, high levels of radiation, and other environmental challenges specific to Mars. So basically, genetic adaptation of future generations to adapt to specific conditions on Mars. So advanced medicine will be certainly essential for stability of human colony on Mars and to maintain, propagate human life on Mars in the future beyond 2050. Also, biomedical information and research data on Mars will be useful for medical advancement on Earth. So I guess eventually we see this independence on Mars. Still there will be communication with Earth and exchange of biomedical information and research data. So Earth and medicine on Earth will equally benefit from research data obtained on Mars. And also, in addition to Mars and Earth, the advances of medicine on Mars will be essential for successful exploration of the rest of the solar system and also deep space beyond in the future. Well, there will be also challenges associated with highly advanced medical in future. We don't know yet exactly what challenges will be most significant, but definitely there will be challenges. So we should also be aware with, such as ethical, social challenges associated with merging human with artificial intelligence. Artificial intelligence technology embedded in human body, continuously monitoring, scanning multiple biometric, physiologic, behavioral variables. Ethical questions such as where the human ends and the computer begins, and ability of humans to manipulate themselves. So this will be some potential challenges in the future. Great. Thank you.
Thank you very much, Dr. Klir. So if anybody has any questions, you can write them in the chat or feel free to unmute yourself. We have a few minutes, so do ask questions if you have any. So we have somebody asking if you could please talk a little bit more about ethics. Is there anything else you can mention about ethics?
About what?
Ethics?
Oh, ethics.
Yes.
Yes. Well, ethics, there will be certainly, those are quite challenges. We will have, like we said, there may be potentially quite significant ethical challenges and questions in the future as basically we have in parallel human advancement and artificial intelligence advancement, possibly fusion between human computers. So now, as we discuss those ethical challenges, will definitely come, and that this would be like all other discussion, which for a long time, but potentially again there will be like far in the future we can see challenges of term of two forms of life. We will have human life, we have artificial life, and coexistence of these two forms. And, yes.
Thank you. Another question is about surgery. So how do you think microgravity will affect the way we do surgery? Is there an effect on coagulation or reconvalescence, for example?
Well, that will all actually, we don't know exactly. As I said, we have long-term effects. We don't know. We mostly know limited information in terms of we consider present long-term effects like several months, maybe 1 year. But certainly these challenges of low gravity, low pressure, they will have there will be challenges. But I believe that with this advancement of medical technologies, we can actually solve these challenges.
Another question is about humans born on Mars. Anything you can mention about that?
Yeah, human born on Mars. Yes, eventually, if we consider permanent habitation of humans on Mars, so eventually there will be people born on Mars. There will be several generations on Mars.
And any medical, I guess, concerns or issues related to that you can think about?
Well, there will be all different challenges. We don't know the challenges right now, but with that plan of permanent life on Mars, eventually also I mentioned like the medical genetics, genetic adaptation over generations to space environment.
Next question is, so what do you think would be the percentage of health workers in relation to the population of Mars?
Well, initially there will be like at the beginning stages, when we are saying a process, initially dependence of colony on Earth. So there will be yes, there will be medicine. There will be medicine similar what we have on Earth, somewhat adapted to condition on Mars. Yes, there will be higher ratio, but eventually, as independence will be achieved, and actually medical system will be functioning completely independently on Mars. So there will be, because of those advanced technologies, as we said, that medical professionals will be more or less like monitoring and surveying automated systems. So there will be actually an use of robotics, medical avatars. So there will be probably decreased ratio of medical professionals to total population.
Okay, another question is, have there been any studies conducted concerning emergency medicine procedures on ISS?
Well, some studies were conducted, but they are still going on. They are still ongoing studies. So as I said, at the present time, we have lots of data, but it's ongoing studies. So we still must continue studies. We don't have yet answers to many things.
Please talk a little bit more about genetic adaptation.
Well, genetic adaptation is use of highly advanced medical genetic techniques, which are not yet completely developed now. We already, even at present time, we have certain advancements in the area of medical genetics, but basically goal of it and aim is eventually access and improve human survival and adaptation to specific environment conditions, but genetically. So we will be those methods will change human physiology at genetic level.
So we got one more question that was actually related to the earlier question about ethics, I think, and that was to do with basically when people get ill and they cannot afford medical attention. I guess that goes a bit into a different area, but if you have any thoughts on that.
So if people cannot, people get ill, cannot obtain medical assistance? If
they cannot afford it. So I guess how the kind of economics and ethics related to that.
So I very strongly believe that on Mars in the future, this particular challenge of specific individuals unable to afford medical care will not exist. All Mars inhabitants will have access to medicine because of medical system using, as we said, advanced monitoring. So system will monitor each person individually at all times as far as physiological variables, behavioral variables. So I think this will be not a challenge.
Okay. Thank you. We'll have to end it at this. Thank you very much for your questions, and thank you very much, Dr. Klir, for your insightful talk. Have a good day and continue with the rest of the conference. Thank you very much.
Bye-bye.
Goodbye.